Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to continue on that journey of the case study of Crohn's disease or inflammatory bowel disease. This is part 2 of the case study, so I'll link part 1 at the end of the video. So let's get right into it. So we had that patient when he was 17 was diagnosed with Crohn's. And by the time he got to me, he was 19 years old. January 2022, his CRP or inflammatory marker was 48.1. We want to see that below 1. In February, after being on a strict diet with nutritional protocols, 2 weeks after starting, his CRP went down to 2.7. Okay. When we found out he has 2.7, what we did was we changed his protocol. So we went to gut repair 4 times a day, curcumin 4 times a day, vitamin D, K, zinc, and EPA DHA. We rechecked after doing this protocol, and on February 28th, 2022, his CRP went from 2.7 to 1.25. So we're getting very close to ideal numbers for his inflammatory markers. We also checked total IgA and IgG immunoglobulins because we want to do some food sensitivity testing for this patient. They are on a very strict diet, so we want to be able to add in some foods for this patient. So we want to check total IgG and IgA, which were within normal reference ranges. So we're going to go ahead and do a food sensitivity test for this patient at this point. Additional markers on that blood test showed low iron at 25. Iron saturation was at 6. This is the range 15 to 55. Ferritin was at 7. 16 to 124 is normal range. Red blood cell was normal, but hemoglobin, hematocrit, MCH, MCHC were all low. Okay. Now, I knew this patient was iron anemic even before we started our protocols. So why didn't I supplement iron in the very beginning? So let me explain how this works. One, he's not absorbing iron very well. And 2, when he came in, he still had a small, probably GI bleed, which was confirmed on our stool pathology testing, where his FIT test showed blood. So 1, he was losing blood, and 2, he was highly inflamed. So when you're highly inflamed, you produce hydrogen peroxide. When this tissue is damaged and there's inflammatory processes going on, you have something called hydrogen peroxide that's produced. Now, if you add iron to hydrogen peroxide, you're going to get something called the Fenton reaction. Okay? And this doesn't happen to every patient, but in some patients, you're going to have a Fenton reaction. What that means is that iron will react with hydrogen peroxide, and you're going to get a hydroxyl free radical, or what we call a reactive oxygen species. When you have elevation of reactive oxygen species, what you're going to do is create more damage. You're going to damage more tissues, not just in the GI tract, but in other areas. So in order to prevent the Fenton reaction or the possibility of a Fenton reaction, we avoided using iron until we got his levels, his inflammatory markers down into the more normal ranges. So we were able to do that. So that's my rationale as to why I did not supplement a patient with iron in the initial phases, even though he was iron anemic, because he had inflammatory processes still going on. Now, what are our next steps? So our clinical thought process is we want to add more foods. So adding foods is an important factor for this patient because we're on a very strict, what we call autoimmune paleo diet. So what we want to do is we're going to check for food reactions. We're going to do an IgG, IgA testing through Cyrex labs, and we want to see if gluten alternatives are going to be safe for him. So remember, I did an IgG and IgA total in the blood work to see if he's going to have a proper immune response to any foods that he's going to be sensitive to. Now we're going to do the food test through Cyrex labs, Cyrex. We're going to continue to monitor his CRP and his iron markers over the next 4 weeks. And then at this point, we're going to add vitamin C, ferrous bisglycinate chelate, which is iron, and betaine hydrochloric acid. So at this point, we're adding iron, and then we're doing some food sensitivity testing, and then we're going to do some follow-up labs to see if his iron deficiency will improve. On another note, he had 2 follow-ups with his specialist, right? The Seton apparatus or procedure that was done was removed on his last visit, which was this past week. The doctor who removed it said his inflammatory bowel issues are pretty much gone. He doesn't see any damage there, and it was removed. He went to see his gastroenterologist also and showed them the blood work that we did for him. And at this point, he's able to get off of his medication, Entyvio. So basically, they stopped Entyvio. Inflammatory bowel or Crohn's disease is in remission at this point, but we still have some work to do, right? We want to get this patient to optimal health, not just feeling better, but we want to get them to an optimal level, and we want to start adding foods so that his quality of life will start to improve. So basically, we took a patient in about 4 weeks needing Entyvio and needing additional visits to specialists and doing MRI follow-ups and all these testing, and we were able to turn his life around in about 4 weeks. Now, this is a case that where the results were very rapid, right? Not all cases go this way. Most cases take about 4 to 6 months, up to a year. So you have to be patient. Not everyone's going to improve in the first 2 weeks. So you want to be patient with your protocols and stick to your recommendations that your provider makes for you. And you really should need guidance. You can't go ahead and tackle this type of chronic inflammatory processes on your own. So you need a good provider to handle that for you. All right? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Have an awesome day.